If you have scoliosis, you might have been told from your doctor or medical professional that you need to stretch more. And that was similar in my experience too. But becoming a physical therapist and specializing in scoliosis myself, I learned a lot about why stretching may not be the only or the first thing for many people with scoliosis to do to help reduce their pain. So in this video, I'm going to explain why stretching may be helpful, but not the most effective way to address your scoliosis pain. We actually have to talk about why stretching works for some people and maybe not others, and what you can potentially do instead to help reduce the tension that you're feeling. Welcome to the Strength and Spine YouTube channel. My name is Dr. Beth Terranova, and I am a scoliosis specialist physical therapist, as well as someone who has scoliosis myself. Let's set up the scenario. Maybe you've just been diagnosed with scoliosis, or you've had scoliosis for a very long time. Maybe you were diagnosed as a teenager, or maybe you're a parent that your teenager has been diagnosed, and maybe you're having some muscular tension or pain related to your scoliosis. The first thing that the doctor might tell you is either start doing some stretching, or they might refer you to a physical therapist. Unfortunately, most physical therapists don't have a ton of training in working with people's scoliosis, so you may just get kind of some general stretches to work on. And you go home, you do those stretches every day, and maybe the tension relieves for a few minutes, a few hours, and then it comes right back. You feel like you just need to continually stretch to be able to relieve your muscle tension. It puts you in this kind of cycle where you stretch, you feel better for a little bit, but then within a few hours or even a day or two, you feel the tension come right back. And this was what was happening to me when I started my journey with my scoliosis. When I was a teenager, I wasn't sent to any physical therapy. I just learned what to do based on my own interest in weight training and strength training. So I was working out with weights in the gym, and I was noticing that my back was tensing up and getting uncomfortable with some of the exercises I was doing. At that time, there was no scoliosis specific exercise or scoliosis specific therapy, so I was just doing massage, chiropractic, general stretches to try to get my tension to go away. And it wasn't until I went to physical therapy school and I learned about scoliosis specific exercise. I learned about Schroth method and other methods of scoliosis exercise, and learned that actually there are exercises that can help your scoliosis curve and improve it without just doing a ton of stretching. I was in that same scenario where I was stretching, and then like a day or two later, the tension was coming back. And what I didn't understand was actually my body didn't really need more stretching. It needed more stability, and it needed more support for my curve because my muscles were just working extra hard to try to hold me in alignment because of my scoliosis curve. I want to explain some scenarios where stretching might not be the first go-to, or maybe you might need to modify the stretching routine to get more out of the exercises. One of those examples is if somebody is already flexible or hypermobile, they might not need more stretching. So if you're the person who is in dance, ballet, gymnastics, where you can bring your leg back over your head and you can roll into a pretzel, you probably don't need more work on stretching or flexibility for your scoliosis. What you need is probably more stability to help support your spine. Because when you are someone with a very flexible or hypermobile spine, your muscles are likely working overtime to try to hold you in alignment for all of those activities that you want to do. So not everyone with scoliosis actually should be doing stretching exercises. If you're someone who's already flexible or already mobile in your spine and your body, you probably don't need to be doing a ton of more stretching. You probably need to focus more on exercises that are going to help strengthen the muscles around your spine. Another thing to understand about scoliosis and why stretching is not always effective for it is because scoliosis is actually a three-dimensional condition. The spine with scoliosis, when you look at the x-ray, looks like a backwards letter S for people, for some people, or maybe like a letter C on the x-ray. But what you don't understand is the curve is actually three-dimensional. Think of your scoliosis curve more like a spiral staircase and less like the letter S. If you're doing stretches where you're just leaning to one side or you're just rotating one way, you're not addressing the curve in three dimensions. Think of it as if you took that spiral staircase and you tried to bend it over. That's not going to unravel the rotation of that curve, right? You can't just take something and say, okay, I'm just gonna lean it the other way to try to undo it when it's a three-dimensional structure. A lot of the traditional general stretches for scoliosis are not considering that three-dimensional piece. Another thing to realize about stretching with scoliosis is that improper stretching might actually be causing you to lean more into your curve, causing you additional pain or additional tension. So let's say you have a scoliosis that is shaped like an S curve, meaning that you have a curve one direction in your upper back and you have a curve another direction in your lower back. If you decide to just stretch one of those curves, you might be leaning or enhancing the curve below it. Let's say if you're saying, okay, I'm gonna lean over this way to stretch out my one curve, and you have a curve below, you're actually making that curve a little bit worse while you're doing that stretch. So you may not want to actually do that type of stretching if you have scoliosis. And the same for rotation. If you're rotating one way and you're really trying to rotate one of your curves, the other one is coming along for the ride and potentially rotating more. This is something that we don't want to do because this might be causing more tension or more discomfort, because you're addressing or thinking that you're correcting one curve, you're actually making the other one feel worse. And this can happen even if you just have a C curve. So let's say you just have one curve in your spine. Realize that there's still transition points above and below that curve where you may potentially be putting more pressure or more tension through those areas. So even if you have a curve like this and you say, I'm gonna stretch it this way, you still have areas above and below that curve that could be affected by that stretch. Another thing to consider if you're doing stretches with scoliosis that involve a lot of bending or rotation is that your curve also has transition areas. These transition areas are where one curve is changing direction and going into a different curve. Sometimes with a lot of stretching, those transition areas can become areas of discomfort as well. Really, we want to work to stabilize those areas because of how that curve is changing direction from side to side. If we're doing a ton of stretching through those areas, we may find the muscles actually becoming more tense because then they have to come in and give more support and guard to help stabilize the area. Doing stretching that is kind of just general or might be typical for a population of people who has back pain is not always the same way effective for people who have scoliosis. Scoliosis is a structural change of the spine that we can't just bend or twist in whatever way that we want to, as opposed to those who don't have scoliosis, who are doing these type of rotation, bending, side bending stretches. If you're thinking of adding some stretching to your scoliosis routine, and in some cases that might be appropriate for some people that actually have issues with the flexibility of their muscles, you need a plan to be able to do that. You need something that's going to be structured and individualized for you. You can't just go in and follow some general online scoliosis stretch routine. What you need is to test and actually see what areas are actually not flexible that you need to improve the flexibility, and what areas actually have enough flexibility but you need to stabilize. And this is why in our Stretching with Scoliosis course, we go over testing to actually determine, is this muscle flexible enough? And if it is, maybe I need to work on a strengthening exercise instead of trying to increase flexibility of an area that is already mobile or already has what it needs to. Because if you're just stretching an area that's already mobile and already flexible, it might not be a really good use of your time. And that's when you end up in that cycle that you stretch it and the tension just comes right back. If you pass that flexibility test, then you know, okay, I just need to strengthen this muscle to help give me more support. And that's where you can really hone in individually for you and your curve where you need to focus. Now, you may have gotten to this point in the video and said, but Beth, I actually do just like to stretch my back. It does feel good for me. So what I would encourage you to do is to check out my next video where I'm actually going to talk about some safe and effective stretches for your scoliosis curve that are not going to compromise your scoliosis curve by putting more tension or discomfort through those transitional areas, and to help improve your alignment rather than just staying stuck in that cycle of stretch and rebound and stretch and rebound. So I'll see you on that next video.